And now we are joined by Dr. Brigid Evans, who's the Senior Policy and Research Officer at Women with Disabilities Victoria. And Brigid's going to speak with us about a co-authored discussion paper that's published by Women with Disabilities Victoria last week that focuses on issues of access to pleasure and consent for women and gender diverse people with disabilities. Now, the paper opens up a conversation about barriers faced by women and gender diverse people with disabilities to accessing sexual and reproductive health care and to freely exercising affirmative consent. In her role at WDV, Brigid provides access to governments and service providers on primary prevention of disability and gender-based violence, as well as disability-inclusive sexual and reproductive health promotion. And we will have a link in our show notes to the paper, Pleasure and Consent for Women and Gender Diverse People with Disabilities. And for now, we are joined by Brigid to talk about it. So good morning.
Good morning, Priya. Thank you so much for having me.
Yeah, thanks very much for coming on. Now, I wanted to start by asking you about the relationship between pleasure and consent and why it's so important to think about these together when it comes to sexual and reproductive health.
Yeah, great question. Thank you for starting with this. So first off, so much of sexual health care and sex education is focused on harm and risk reduction, often to the point that it completely overlooks why most of us have sex or want to have sex in the first place. Because it feels good and it helps us to connect to ourselves and with others. The World Association of Sexual Health, in fact, states quite clearly that sexual pleasure is fundamental to sexual health and well-being, and that critically, pleasure needs to be talked about as part of our sexual rights in relation to bodily autonomy and freedom of expression, which is how consent starts to come in. So if we focus on sexual pleasure in sexual health care, on the fun, on the messiness, on the full reality of sex, rather than just the risks associated with it, then we are more likely to have better and safer sex. Also, when you can comfortably talk about how you access pleasure, you can better identify where your limits are and what you might enjoy with respect to, say, your body's mobility or a chronic condition. This also means that you'll be more likely to be able to respond to pain when it occurs and to negotiate ongoing consent in a more inclusive manner. We also saw through our research and our consultations with women and gender diverse people with disabilities that pleasure can help people to reconnect to their bodies and to overcome internalized societal harms like shame, trauma, gender roles, and violence. So it can really be quite powerful for people.
Yeah.
But from our perspective, many people take the idea of pleasure for granted when it comes to our sexual health and safety. We see this regularly in our community. Women and gender diverse people with disabilities who engage with the healthcare system quite a bit, they don't get the same information as everyone else. This is sometimes because that information isn't accessible. Sometimes it's because healthcare workers don't realise or forget that we might need this information. Other times it can be because workers are more focused on other concerns. But the lack of accessible engagement and information on this topic for our community means there can be a real lack of confidence or even a deep confusion when trying to respond and repair and recover from sexual health issues or from violence itself. So, if we bring everyone into the conversation and we talk about pleasure and consent and sex in a more realistic way, we can support the sexual health and autonomy of everyone better.
Yeah, and I think what you said there is so important because when we think about autonomy, bodily autonomy, and agency, that also touches on the issue that consent is not just limited to sex. It's a critical part of the way that we exercise that agency, that bodily autonomy. And so in light of this and touching on what you mentioned about access to information and even just access to healthcare providers that see women and gender diverse people with disability as full humans. Can you tell us about how the ableist status quo does impact the way that women and gender diverse people with disabilities are equipped to exercise consent in both sexual and healthcare settings?
Yeah, another brilliant question. We find that because of disability and gender-based stigma and biases, many community and healthcare practitioners can be really exclusively focused on the alarming statistics about the issues that we face. And this can then lead to protectionism, where important information and opportunities are withheld or they're watered down. This can mean that we end up excluded from activities that we might enjoy. It can also mean that we are put in situations where we can be harmed because they haven't considered our consent or what we want or how we feel about things. Sometimes they don't even realise that we have sex, and so important health questions can be missed. So it really, it needs to be recognised that if your body has been treated like a medicalised object for most of your life, or if something happens to you during your life that leads to injury or illness or disability, how medical practitioners interact with you can really impact your self-worth. It can impact how you might access, relate to, and advocate for your own needs. If your agency is regularly dismissed or placed as secondary to medical concerns, this can change how you feel about what you enjoy and the way that you explore your sexual identity safely, either by yourself or with others. So while healthcare might not always model consent well for our community, I think health promotion is actually a really perfect space to develop skills in relation to consent. Within healthcare, there are so many regular opportunities to model things like boundary setting, responding to the boundaries of others, providing care if boundaries are breached. And these are skills that everybody needs to refer to and update with guidance from their peers, their colleagues, and community members. The conversations that you've touched on that are happening about affirmative and enthusiastic consent, they're really interesting right now because they've come through successive sweeps of lobbying over generations, as well as evidence of what works, legislative reform, and now a huge push in resourcing in education and youth settings in particular. All of this means that there are now public campaigns that are rippling out into the community. However, only a couple of those campaigns have actually been co-designed or produced in consultation with members of the disability community. We want to make sure that our community are not left behind, but are instead central to all of these awesome changes and the systems that we are regularly engaging with.
Yeah.
So,
Go ahead.
No, I was just going to add that healthcare practitioners, they can be gatekeepers of information and support and justice and change. This is a really awesome power that can be used for good. And while a lot of people in our community have been let down by the healthcare system and have had to find their own community-based resources, I think there are also so many practitioners out there who want to demonstrate that they can do better. And the resources that we're developing, we'll obviously touch on soon, they're really doing an important piece of work that's designed to build on the strengths of practitioners so that sexual health and well-being doesn't continue to rely on just individuals to do all of this exhaustive work of self-advocacy every time there is an issue. That was my only extra point there.
Yeah, no. Well, I mean, it's a great point because the burden of self-advocacy is one that is placed on women and gender diverse people with disability. It's not, I think this really flips the script on vulnerability, and instead of, dismissing, because I think it's very important to recognize the harms that are experienced by and perpetrated against women and gender diverse people with disabilities in relation to their intersecting identities, it turns the focus back on a system that is harmful and that creates the possibility for people's agency, bodily autonomy, and self-worth to be violated in various different ways, and looks at how we can transform that system. So on that, I want to talk to the discussion paper that you've co-authored with Dr. Lena Molnar for Women with Disabilities Victoria, which seeks to reframe those conversations about sexual and reproductive health and sexual pleasure to dismantle those mainstream narratives about women and gender diverse people with disabilities. So here I'm really interested to hear about the significance of thinking about erotic justice, disability justice, and bodily autonomy as interrelated factors that underpin better sexual and reproductive health outcomes for women and gender diverse people with disabilities.
Thanks, Rhea. Yeah, so, I don't think this is going to be news to your program, but women and gender diverse people with disabilities take up a good portion of the community, and many of us do choose to have sex and enjoy it with other people and ourselves quite regularly. And making assumptions about whether or how we have sex or who we have sex with creates harm, and it increases poorer health outcomes. So, for example, according to the Victorian government, just under 40% of the queer community in our state report having a disability or a long-term health condition. Yet so many health practitioners still assume that we're talking about heterosexual relationships. Just destigmatizing the sexuality of women and gender diverse people with disabilities, this requires proactive efforts to challenge societal narratives that fail to recognise or to respect the sexual autonomy and expression of people with disabilities. The evidence suggests that educators and health providers, their bias and their discomfort in discussing sexuality with people with disabilities can reinforce these stigmas that we've been speaking about. And they can also, importantly, limit access to sexual and reproductive health care. So securing better health outcomes and improving the well-being and safety of women and gender diverse people with disabilities, this requires that we challenge these stigmas, but also that we challenge the discomfort that healthcare practitioners, and honestly many of us, feel in openly discussing sex and pleasure. So erotic justice, disability justice, bodily autonomy, these are obviously all huge topics in themselves. And what we've done with this project and this paper is to carve out just one intersection for our community, namely supporting healthcare practitioners to model consent and to begin discussions around pleasure with women and gender diverse people with disabilities. So the work that we're doing is to support change at a systems level in providing access where our community is facing barriers to better health outcomes and to access to these important resources. So, like for another example, like women and gender diverse people with disabilities who live regionally, there are many choices. There aren't many choices about who you can see as a healthcare practitioner. Even fewer, of course, if that building that they are in is physically inaccessible. And having access to like a healthcare practitioner who is willing and able to speak openly and comfortably about all aspects of your sexual health is going to make a really significant difference to the well-being and health outcomes of people living regionally. So we just want to enable healthcare practitioners to be able to have these conversations no matter where they are and where they work, so that our whole community can be included in these conversations.
Yeah, it's about improving the capacity of the workforce, the healthcare workforce, and the literacy of the healthcare workforce in engaging in these vital conversations that really speak to, the heart of people's experiences as humans in the world that are engaging in relationships, that are exercising consent in a variety of different ways, and making sure that, practitioners are not squeamish about having conversations about something that is fundamental to the work that they do. So I wanted to wrap up by turning to the fact that Women with Disabilities Victoria is in the process of developing a suite of resources for health practitioners, which are going to launch later this year to improve workforce capabilities in regard to what we've been discussing. So what form are these resources going to take, and where do you want to see them used and how?
This is the really exciting bit. So we've filmed some short videos with some of our lived experience team on the topics of challenging stigma, the power of pleasure, talking about consent and pleasure, and building trust. So all of those topics. We've also written some conversation cards that will provide self-reflection prompts for healthcare workers to use and adapt in their own practice. And to support the embedding of these resources across the health sector, we're also developing a usage guide to help service providers and individuals to use these resources within their own professional development. So these resources we're hoping demonstrate through the voices of our experts that some really simple changes in practice, so even just like asking questions that demonstrate that you want to understand. This can show someone in your community that you want to support their sexual health and well-being in a way that recognises that pleasure and consent are essential components of sexual life and agency. Because it's really important for us that healthcare workers, they're provided, as you said, with this ongoing professional development to support trauma-informed practice. Like, we want to enable them to provide better care and access to good sexual health outcomes across the community, and inclusive of women and gender diverse folks with disabilities.
Yeah, absolutely. And we'll be keeping an eye out for those resources, and we might have to have you back on later in the year to talk about them and maybe talk about their uptake. But for now, Brigid, thank you so much for taking the time to speak with us.
No, thank you so much for having us, and we'd love to be back soon.
Wonderful. And that was Dr. Brigid Evans, who is a Senior Policy and Research Officer at Women with Disabilities Victoria, speaking about the co-authored discussion paper, Pleasure and Consent for Women and Gender Diverse People with Disabilities, published by Women with Disabilities Victoria last week. And we will have a link to that in our show notes.